what are the causes of acne?
So there are four main causes of acne. Basically, it's increased oil production of your oil glands. Second one is the clogging of the pores with the dead skin cells. There's infiltration by bacteria, and also that causes inflammation, and that's where you get acne.
Okay, so those are the causes, but what is cystic acne?
So cystic acne refers to a severe form of acne, and that's usually the ones where you see that don't have a head, there's no blackheads or whiteheads attached. They're the large, painful, red bumps underneath the skin. Those are referred to as cystic acne.
Now, acne can literally pop up on any part of our body, which is a scary thing.
Yes,
but
it is.
How does acne find its way to our nose, our forehead, our back, and even Mike's butt?
So basically, because it's overproduction of oil from your oil glands, so anywhere that you have oil glands, it can happen. Friction and humidity can also make all these things worse.
Will treatment for acne on different parts of the body be the same, or will it be different?
It might be a little bit different depending on where it is. So for example, for your face, it might be a bit more gentle because the skin's a bit thinner there, whereas for things like on your body, on your buttocks, you may need a higher concentration to deal with it.
What are the pros and cons of acne patches?
Acne patches, especially those that are the hydrocolloid ones, they are very good at drying out the skin. So especially if you have an open acne wound that you just popped, it's very good at drying it and preventing further infection. But they may not be as useful for dealing with cystic acne or the ones that are underneath the skin.
So if I were to say acne patches with microneedles can help dry up the pus on cystic acne, is that fact or myth?
Well, it's a little bit of both. There's a bit of limitations with it as well. Again, so with the microneedles, again, it can allow penetration of some of the medications in the acne patches to go a bit deeper underneath the skin, but it may not be suitable for all types of acne.
Okay, why are oral antibiotics prescribed for some patients while others receive topical creams or a certain kind of facial wash?
Right. In terms of acne treatment, we're looking at it as a totality. So generally, these are all the options that I will offer my patients. And it does go based on severity as well. So if someone has mild acne, they may be able to get away with just the wash and the cream. Someone that's maybe a bit more moderate to severe acne, that's where you may need to add the antibiotics in. But it also depends on the patient themselves, what they're comfortable with. So some patients, they really don't like the idea of taking pills and stuff like that. So that's where I may then adjust what we do.
What are some of the side effects of antibiotics if you're taking it for acne? Are there side effects?
So one of the most common ones is doxycycline. So doxycycline for acne, the main one is usually stomach upsets. So if you're taking it on an empty stomach, it can cause a bit of gastritis to happen. Second one is that technically you should be a bit more careful with sun exposure because you're a little bit more likely to get sunburned with that as well.
Okay, so I always hear every doctor tell me, don't squeeze your pimple.
Yes, that is true, yes.
But when it's there and it's out and it's white, you just want to get it out, no?
I know, the temptation is always there. But the thing with squeezing the pimples is that if it's done incorrectly, what can happen is that you can actually damage your skin further. Like, if you try it and then you can't get it out and you keep going at it, and you just traumatize the skin, and it can drive the infection a bit deeper. So it actually increases your risk of scarring and pigmentation changes lasting a lot longer.
Guilty as charged. I've done
That's everyone. That's everyone.
All right, what are some of the benefits of aesthetic intervention in treating acne scars?
Okay, so what I would say is that even in just acne in general, early aesthetic intervention can reduce the severity of the acne that you're undergoing, and it can provide faster resolution to the problems, such as your scarring with like microneedling or like lasers with the pigmentation changes that happen.
Well, there you go. I hope that certainly taught you a bit more about acne and how to deal with it. Thank you so much for joining us, Dr.
Thank you
Paul.
so much,
It was great
Catherine.
having you on the show. We'll see you very soon.
Thank you.